and welcome to this session. I'm Dr. Mary Binoy, and I'm talking from Envertiz Academy. We have both online and offline classes, as I had reminded you last time. So please do come to us. You can join our batches. We start our batches on Mondays. Okay, so before I start on with this session on OET writing, may I wish all of you a Merry Christmas and a Happy New Year. Wish you have a wonderful 2025 and really hope it's going to be great. Okay, so today we'll be discussing the next two criteria of OET writing, namely conciseness and clarity and genre and style. So before we go to those two criteria, let me just remind you of the other two that we had done on the first day, which was purpose and content. Just let me just go through these criteria. We have criteria and all, as you remember: purpose, content, conciseness and clarity, genre and style, organization and layout, and lastly, language. Purpose is marked out of 3, whereas all the rest is out of 7. So, to get your required score, you would have to write a letter that stands within the framework of these criteria. Why I tell you so is that as OET mandates, a criteria based letter is what gets you your score. So I think I've told the introduction for all this. I was just waiting for the rest of them to join us. Yes, I think most of them have joined. Yes, so I would say we could start with the third criterion, which is conciseness and clarity. Well, before we go on to it, let me just tell you, why these are important. I would like to compare the criteria of OET writing to your rules and regulations in driving. So once you know the rules and regulations, you know what you need to follow. But that's not all. You need to know how to drive a car actually. So that is when you do how to transform your case notes. Well, that will be taken in one of the next sessions. But as of now, yes, we will be doing this, the two criterion. As I told you, we're starting with conciseness and clarity. It's marked out of 7. This criterion actually tells about a few rules that you need to follow to maintain the conciseness and clarity of the letter. Firstly, as we would be seeing on the screen, the right length of a letter. What is this right length? As you see in a case note, almost towards the end, you see it's written the letter should be between 180 and 200 words. So it means that if your letter is well below 180, you have not included all the necessary details. And if it is way beyond 200, it just means that you have added unnecessary information. So, how do you know what's required and how do you know that you've included them? Well, that's where we have 3 words that I need to just tell you about. The 3 words are relevant, semi relevant, and irrelevant. What are those words? Relevant means better. Semi-relevant information is what you may or may not include in the letter, and irrelevant is what that must not be included in a letter. Well, does it make any difference to the marks? Definitely, yes, and that's why it's important. Relevant gets you marks in both content and in this criterion, that is conciseness and clarity, whereas irrelevant makes you lose marks in this particular criterion. So you see now, it's important. You must know what's irrelevant and you must know what to exclude from your letter. So coming to that, before I go on to look into the relevant, irrelevant, and semi-relevant, I would just want to tell you about how to go about this with an example. Say, I have a patient who comes to me and she is in her third trimester of pregnancy, say roughly in the seventh month of pregnancy. And she tells me that, well, she's had a toothache since the previous day. So, and today morning she says that her fetal movements have decreased. So I see these two are her presenting complaints. I go on, I ask her about her, the history, and she says, well, she has had a previous abortion, she's had a tubal pregnancy, and yes, she goes on to tell me she has got a molar tooth extracted around, say, about 7 8 months back, and I see she has her orthodontic braces on. So I asked her about it. She said, yes, she started the treatment last year. So all this kind of adds up to what a case note is. Now it's up to me to choose what is required and not required. Well, I give you the task of doing it. So let's go one by one. Say we start with the first one, which is the tooth ache. Do I write? Yes, I do, because yes, exactly. You're sending her to a dentist. That's the exact reason why I'm sending her to a dentist. The next is the fact that she's pregnant. Do I tell that to the dentist? Yes. Yes, I see answers. Yes, 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 I do tell her. Okay, I have someone telling me no. Oh, why is that? No, I have to tell because see, the dentist has to give her medicines according to her condition. There would be certain medicines, for example, that you can't give during the when she, because she's pregnant, you couldn't give her certain medicines like certain antibiotics or something. So the obviously the dentist has to know whether what is her condition presently. So I have to tell the dentist that she's pregnant. The reduced fetal movements. Do I tell the dentist about that? Yes. I have one or two of them saying yes. Okay, the rest of you have said no, right? Yes, the answer is reduced fetal movements need not be told because I'm not sending her to a gynecologist, I'm sending her to a dentist. So it does not have to be informed to the dentist. The next is about the previous abortion. No, not required. Yes, correct. Not required. What about the extraction of a molar tooth? Well, that could be mentioned to the dentist. What about the history of tubal pregnancy? No, right. It's not to be told. What about her using braces? Yes, that also has to be told. So now we have information that needs to be told and that need not be told. So we have divided it into two, relevant and irrelevant. Okay, so after having said that, I just want to go back to the previous one. I want to say that need to, as I was saying, the right length. So you include the relevant information and you may include the semi relevant information and you have got the right length. Now you need to summarize the relevant information. That's one another thing. And the last is your ideas should be written clearly and should be easy to follow. Well, I would like to give you a few pointers on that. How do you know how much to write? Yeah, how do you know how many paragraphs, how many pages, how much is 180 to 200? Well, that depends upon your handwriting. Yes, your handwriting is something that will actually tell how much needs to be written. Might have to write a couple of letters, count those letters every time you write, you know how much you have to write. Because I'm sure exam and during the exam time, sitting and counting just makes you get worried. So once you start writing, write a couple of letters. Count those. Every time you write a letter, count the number of words. Mind you, start from the introduction, go up to the last sentence, and that's how you count your letter. You count the number of words, see that it is within the 200 word limit. So you have to, once you count, you know how much you need to write. It would roughly account to almost 1 to 1.25 pages. That's how much it has to go. And see that you write 3 to 5 paragraphs, which means a minimum of three and a maximum of 5 paragraphs. When you include history, it might go up to 5. When you don't have history, it might just be 3 paragraphs. So, it depends, 3 to 5 paragraphs. Each of the paragraphs up to 6 to 7 sentences. So, roughly a good letter. And always remember the purpose of the letter. So, know what you're writing the letter for. Why are you writing the letter? To whom are you writing? Keep this in mind. So, once you've kept that in mind, I'm sure you'll make, you will be writing a decent enough good letter to get you your score. So, just want to give you a question that you can ask yourself to know whether it's relevant, irrelevant, or semi relevant. The question that you need to ask is, does the reader need to know this or this particular information in order to fulfill the purpose of the letter? So, you think you want, this reader should know that information, please write it in the letter. You think, no, the recipient need not know about this, leave the information. Do not include it in your letter. Okay, now I would like to just go through a portion of a case note to just tell you how to summarize information effectively. When I say effectively, I know you must be thinking, what's so difficult about summarizing information? Believe me, just go through this case note and you'll see what's actually difficult. So, this is part of a case note which says about the presenting complaints. So, this particular patient, let's call her Mrs. George. She comes to the hospital, and on the first day, that's on 15/1/2022, she comes with a toothache which increases at night. She was given a painkiller and the pain subsides. Then she comes back on 17th, that's 2 days later, with a severe toothache. She's got a slight fever now, and we've given her analgesics and antipyretics. Okay, she comes on 21/2022, that's the present day. She has a severe toothache. She's got the fever. She's unable to open her mouth. She has a swelling on the cheek and slight ear pain on the same side. So, this is the information that is given in your case notes. Now, how would I write it? Well, there are two ways that I have just written it. The first one says, Mrs. George initially presented with a toothache on 15/1/2022, which increased at night, for which she was given a painkiller and the pain subsided. Later, on 17/1/2022, she came back with a severe toothache, slight fever, and was given analgesics and antipyretics. Then, on 21/2022, she presented again with the same severe toothache, unable to open her mouth, swelling on the cheek, and a slight ear pain on the same side. Well, I have actually given you almost all the information that was required, but let's see the next one. Mrs. George presented with a severe toothache and slight fever. Today, she represented with the same symptoms along with inability to open her mouth, swelling on her cheek, and a mild ear pain. So you can see that I have written actually two summaries for both these, or two information. Two pieces of both are the same information. However, in my second bit, I have actually summarized it effectively because I have seen to it that I've not repeated words. For example, I didn't keep saying about the same severe toothache. I don't have to say that. I can just say today she represented with the same symptoms. So here I have used words very effectively. I'm not repeated in words. So it means that I have written my summary in a better way. So remember, you're writing your letter to a medical professional and you shouldn't be overcrowding the letter with unnecessary information. So to get a good score for the criterion, check the length of the letter as I was saying, practice summarizing and paraphrasing. Most importantly, write only relevant matter. See that you include relevant matter. See that you can summarize and paraphrase your information. So that's exactly what I have done in the second paragraph. And I have paraphrased, I have also summarized the information to such a level that the recipient understands what has been told, but I have given it in lesser words and have been very concise about it. So, this is what we say as conciseness and clarity. So, before we go to the next criterion, I would like to take a short break. So, see you after the break with the next criterion. Welcome back after the break. So, before the break, we had done conciseness and clarity. So, this time, the next is genre and style. Well, genre and style is the fourth criterion of OET writing, and it is totally marked out of 7. Here, again, you need to follow certain rules to ensure that you are following this criterion. Let me take you through those rules. Firstly, you should not make or do not make references to the marital status of the patient, especially that those that have a negative tinge. Now, when I say a negative tinge, I would like to give it, make it more clear with an example. So instead of writing he's divorced, it would be better to write he lives alone and does not have a strong support network. So that would be more appropriate. Do not make references to the patient's refusal to follow instructions. So, say the patient is not willing to follow certain instructions, please don't, make references to that. Again, I would like to give you an example on that, which is say the sentence that you had written was the patient was advised to stop smoking but has refused to make any attempts. Well, it would be better phrased as he smokes 20 cigarettes a day and has been unable to reduce this. So that's the better way to say it. Similarly, instead of writing Mrs. Becker binge drinks at the weekends, you can write Mrs. Becker consumes 15 units of alcohol at the weekend but rarely drinks during the week. So I would say, you're being less judgmental there. So instead of saying she binge drinks, binge drinking, saying binge drinking or saying a chain smoker, well, that would be judgmental. So to be less judgmental, you would say she consumes 15 units of alcohol at the weekends, but rarely drinks during the week. Also, refrain from using words such as regretfully or regrettably or unfortunately. Please don't use these kind of words, they have a negative tinge to it. So, don't use these words. Now, I would like to tell you about certain opening phrases that you could use, quite important. I think I'd already told in my last session about certain opening phrases like I'm writing to refer, and yeah, I had given a horde of them. So I would like to give you some more opening phrases. You could say you're a nurse and you're writing to a doctor. You can say, "Thank you for seeing Mrs. Becker." You could say that. That's I think quite a different opening phrase. You can also say I'm writing to introduce Mrs. Becker. Okay, so we've got two good opening phrases. Another thing that I would like to tell you is use the appropriate verbs to denote actions. What do you mean by appropriate verbs? I know you must be in a fix what to say. So instead of telling she had a surgery, you actually rephrase it as she underwent a surgery. Similarly, when you have the sentence, her vital signs were checked closely during her hospitalization, would be quite informal, I would say. You need to say it as her vital signs were monitored closely during her hospitalization. See, a better way of saying it. So that's what I said. Use the appropriate verbs. These appropriate verbs um, should be used in your OET letter rather than just saying words like had or checked. So we've got better sentences. Similarly, instead of writing Mrs. Matthew is being moved to St. John's Hospital tomorrow, you write it as Mrs. Matthew is being transferred to St. John's Hospital tomorrow. Likewise, I have one more sentence. He will need his clips to be he will need his clips taken out in 2 weeks' time is not taken out. You could use a better word. He will need his clips removed in 2 weeks' time. So instead of saying taken out, you use the word removed. Now, just like these opening phrases, I have some closing phrases as well. It is what the end of your letter. Sentences like, if you require any further information, please do not hesitate to contact me. That's one closing phrase. Another closing phrase would be, should you have any queries, please do not hesitate to contact me. Or you could say use another sentence, please contact me if you require any further information. So you've got three good sentences. Please make a note of it so that you can use it in your letters. So now we have gone through the closing phrases and the opening phrases. The next thing I would like to say is about abbreviations. Please do not use abbreviations. And I would say the golden rule is uh, if you're not sure the recipient will understand it, please don't use an abbreviation. So, on the safer side, try not using abbreviations anywhere. For example, instead of writing POP, better to write plaster of Paris. Similarly, you have like the words URT. Please do not write URT, write it as upper respiratory tract itself. UTI, which is urinary tract infection. So write the full forms of it. Don't write the short forms. Not allowed. Actually, it's not a good practice, I would say. Similarly, with contractions. Um, what are these contractions? For example, when you want to write she is, we're so used to typing messages on our phones that we have this practice of writing she apostrophe s, which denotes she is. It's better to write she is itself. So, similarly, when you write I am, you have this habit of putting I and apostrophe M. You need to write I am. I've seen a lot of students write I am in short, in contracted forms. Please don't do that. Write the full form of it, I should say. I am, she is, he is. So it should be this way. Next, I would like to talk about polite request phrases. So you need to use phrases and not questions, and that to use polite ones in your letter, even in your speaking for that matter. Say you want to, in your letter, you want to know about the medication compliance. You're not going to write, can you monitor, you want to tell someone whether that person could monitor. You're not going to write, can you monitor his medication compliance? You would instead write, it would be if you could monitor her medication compliance. So you're putting it as a polite request. Don't put it as a question, instead put it as a polite request. Similarly, say you want a person's home and surroundings to be assessed, and you have just written his home and surroundings need to be assessed. That doesn't sound too polite, I would say. So it's always better to write, your assessment of his home and surroundings would be appreciated. So you've got a better, polite way of wording it. The next one I would like to tell you is Mrs. Smith should attend some groups of support. See, you've written the sentence like this. It would better be worded as it would be appreciated if you could introduce Mrs. Smith to some support groups. So if you got a better sentence, definitely you will get marks. I mean, it will gain you better marks. I would say better marks in the sense you're writing a polite request and that is going to get you your marks. So you must see that whenever you write your letters, you could use connectors. So I'm sure you're familiar with this word connectors. What we say in our literature, it's known as conjunctions. Well, there are a list of conjunctions that you can use and that you should not use. Let me just tell you about two types of connectors. There are both simple connectors and complex connectors. Well, there are certain informal connectors that you must not use. For example, meanwhile and besides. They must not be used in a letter. Similarly, there are certain connectors that are too academic, I should say, like furthermore and moreover. Please do not use these as well. I would say preferably don't use this. It's not required. Okay, so try using the other connectors. Yes, I will be taking a class on connectors. Yes, I can see some of you really worried. What are these? What are connectors? And suddenly something new pops up. Yes, I know it is quite important. Well, as I keep telling, come to us, come to Envertiz Academy. We do detailed classes. We have classes on all days from Monday to Friday, and we give you detailed classes on all these, including sessions on just 1 day sessions on each of the modules. Each of the days we go with different modules. So do come to us. I hope you know where we are. We are at Tripunithara. So please do come to us. Okay. And yes, when you're preparing for the OET exam, see that you get a list of more appropriate or slightly more what you could say formal phrases compared to their informal versions. For example, recover or recovering would be better than get better. See, you could use the word get better in your speaking. That would be okay, but not in your writing. Writing needs a little more formal way of writing, and that's what we look into this particular criteria. So I would like to also tell you that uh, when you write, when you want to practice letters, you have to make a list of appropriate language. Make a list of these appropriate language. Write it down in your notebook. Have a notebook for writing where you put all these appropriate phrases. Now I've given you a lot of opening phrases, closing phrases, polite phrases. Make a list of them, and when you write letters, use keep try using these, because unless you use it, it will not come to you when you write a letter for your exam. So I hope you know the exam is a 45-minute exam for writing. You have 5 minutes of preparation time and 40 minutes of writing. So when you do this 40 minutes of writing, to break it up effectively, strategize it. That is, you use the first 2 3 minutes for just just selecting and organizing your letter. Once you've done that, you start writing. Try finishing your letter within the 35 minutes, and then the last 2 or 3 minutes, whatever you have remaining, is for proofreading. Never submit a letter without proofreading, because I've seen a lot of people make gender changes, especially because they have not proofread their letter, because they would know it is a male patient, but I don't know, by mistake the word her or she creeps in, and you lose your letter. So once you've had a gender change, I'm sure you all know that you wouldn't get your required score. So please be careful. So make a list, as I was telling you, make a list of all those phrases that you could use. Write it in your notebook, keep it with you. And when you're practicing letters, try using these phrases one after the other. See, you can use these phrases where it can be used. Use linking words, as I just told, linking words or the connectors that I just told you. and see what connectors you can use in particular. See, you want to join two sentences, you have to combine two sentences, you must know what connector to use and where to place the connector. So once you've written your letter, get it corrected from an expert who is an expert in OET, especially a person who knows the criteria and knows to correct letters based on the criteria. Mind you, once you get your letters corrected by a person who knows such way of correction, your letters will improve. So that's why I keep telling you, come to us at Envertiz Academy. We are here, and I'm sure you'll be able to do complete justice to your letters if you get it corrected and unlearn your mistakes, relearn the new things. So, as I said, use the right connectors, practice writing. You have to practice it. It's a module that needs practice, just like how you practice your speaking. Do smart work. That is, once you write your letter, don't keep writing the same over and over again. You understand your mistakes, go to a new letter, learn from those, and make a list of common verbs that you use in OET. There are a lot of verbs that you particularly use. Like today, just we learned underwent. He underwent surgery, or say the word recovery. So you've got a lot of verbs that you use in OET. Practice all this. Only practice will help you to improve on your letters. Not everyone is good in writing, but practice makes you good. So you need to do that. I would like to remind you that since we are taking a break because we have our Christmas coming up and New Year, we will be seeing you only next year, or say that is 2025. So we'll be taking a break for the next two. Be back in the new year, and please await us for new sessions. Please write to us. I want to know what you want to see from me next. What is the next topic that you want to hear from me? Which module you want to hear? What is it specifically that you want me to talk about? I will come back with those classes, and I wish all of you a wonderful Christmas and a New Year. And I will see you on the other side, that is in 2025. This is Dr. Mary Binoy signing off for now. Bye.